Welcome to another episode of Connecting with the Toms. I'm Julie, your trauma-informed movement coach.
I'm Dr. Tom, sitting here in beautiful Arizona.
And today we're going to dive into the world of dentistry, but specifically root canals and fillings and the metal that is in your mouth. But before we do, I'm going to start you off with a fabulous breathing drill that's been around for for a long time, for the ages of time. It's I learned this when I did my yoga teacher training. We're going to do some alternate nostril breathing. So there are lots of different techniques, and as my dad often says, it's not necessarily about doing it right or wrong. We just want to see how it feels. So before we start this exercise, I just like you to do a quick scan of your body. Just do a quick what are you feeling in your body in this moment? If you're not sure of the sensations, what color do you feel? Fantastic. If you want to go grab your HRV device, go check your HRV. You can hit pause. We'll wait for you. Okay, got it. Good. Now what we're going to do is check your HRV, see what your number is, and we're going to do an alternate nostril breathing. We're going to do 3 rounds, 1 for yin, 1 for yang, and 1 for you energetically. And basically how this works is that you're going to close. We're going to start by breathing in on the left nostril. So you're going to close the right nostril. You're going to breathe in on the left, and then you're going to close the left nostril and then breathe out on the right, and then breathe in on the right, close, and then close the right, and then breathe out on the left. Did that make sense? I hope so. Okay. Okay, good. So I know it's a little bit awkward because you're just listening to this, but you're going to hear me breathing, and the timing, I'm going to leave it up to you. Okay. So if you can't breathe in as long as I am, or if not exhaling as I am, that's all good. Just follow your rhythm. But basically, we start with closing the right nostril, and then we're going to finish and end on the left side. Okay. Sound good? All right, let's go. So go ahead and close that right nostril, and go ahead and begin. Breathe in. Close the nostril and breathe out through the right. Breathe in on the right. Close. Breathe out. That's 1. Again. In on the left. Close. Open the right. Breathe in. Close. Out on the left. 1 more time. Breathe in. Close. Open on the right. Breathe in. Close it and breathe out. Fabulous. All right. Okay, a couple things that came up for me. I was doing that. So some of you, if you struggle with congestion in your nose, a fabulous thing that you can do before you do that, because you can notice like, oh my God, I can't breathe in on one side of my nostril. You can do a nasal decongestion drill. Basically what you do is you inhale, exhale, plug your nose, and then you're going to shake your head. And then what you're going to do is you keep shaking your head like yes or no, and you're going to hear your ears pop. It's like a Valsalva maneuver, essentially. And what that's going to do is it's going to be able to clear your nostrils. This is a fabulous, fabulous drill for my people who this one actually activates both hemispheres of the brain. This actually creates a lot of balance. And by getting oxygen through nitric oxide through both nostrils, it allows to create more homeostasis, if you will, or more balance. And so if you're feeling right side dominant, if you would say, or if you're feeling a little bit off or out of balance, is a fabulous one. But that being said, that's what the research shows. How did it feel for you? So now do a quick scan. How does it feel? What sensations are showing up in your body now? Hopefully you're nice and relaxed and not too agitated. If you are agitated, then I suggest that you do the breathing drill that does calm you down. Okay. But that being said, I know I have some clients that do this one and they really do not like it. So if that's you, you're not alone. It's all good. But if you do like it, you're not alone either. So there's people in different camps. But without further ado, I'm going to let my dad, the former dentist, tell us all about root canals and the metal in your mouth from a biological perspective. And hopefully, if you haven't heard this information yet, listen up, because there's some really, really important things that you need to hear about your health and how your mouth is connected to everything in your body. So go ahead, Dad, take us away.
Right. So, as we did with the last one, I'm going to make a disclaimer with this one also that the individual aspects that you're dealing with needs to be discussed with your own personal dentist in regards to your own health and the fact that what's going on in your mouth may indeed be contributing to any other type of chronic illness that you have. So just a couple of overviews in the first place. So the opinions that you will hear are 100% mine. They are, for some reason, it seems that in dentistry, there's a lot of controversy. There is a lot of controversy in lots of things in medicine, but this one seems to come up a lot. And this is one area, interestingly, where even as a biological physician, I have a difference of opinion from biological dentistry about certain aspects of that what happens in regards to dentistry. So all I can share is my own personal experience as practicing as a dentist. And many years ago, over almost 45 years ago, I first, obviously I was conventionally trained in dentistry. And in fact, my 50th reunion is going to be any day here coming up, by the time you listen to this podcast. So the 50 years ago when I was trained, the materials that we have nowadays weren't even available. It was, and literally, I remember I was in third year in the dental clinic, and a child had come in and had fractured off their front tooth. And I remember the dental instructor saying, I want you to go up into the library. There's an article that just got published on bonding. And so that's what we're going to do to repair this child's tooth. Bonding? What the hell's bonding? Now bonding is done in every dental office, and it's the most routine thing that we do. But 50 years ago, it wasn't. Actually, it was 48 years ago because I was in third year. So I went up into the library. I read this article. I came back. The dental instructor opened the kit. He said, "Okay, this is what you're going to do. Here's this. Here's this. Here's this. This is here. Here's the material. Da da da." So I literally did a bonding procedure when it was absolutely brand new in this thing. So the opinions that I have were obviously formed and through my practice of the years I practiced dentistry and what I observed, and then they've been reiterated significantly as a biological physician, and knowing that the teeth play an important role and the areas. I won't say they're controversial. There's significant difference of opinion depending on who it is you talk to in general. So, just if you ever want to read a good book about dentistry, you should read the book by Weston Price, Nutrition and Physical Degeneration. It's brand new. It was only published in 1936, so it's only 90 years old. So, like one of those new books, that we talk about.
Oh, there's his humor. There's his humor. If you don't know it, that's my dad's humor right there.
the and so what Weston Price did, who happened to be a good Canadian, like we are, went around to 7 areas of the world at the time that so-called had been untouched by Western civilization. And as a dentist, he was observing jaw structure, facial structure, and their teeth. These people didn't have dentists. They didn't have toothbrushes. They never brushed their teeth, but they had beautiful arches. They didn't have cavities. They didn't need orthodontics. They had wide nasal passages. Their cheeks were broad. Their jaw was fully formed, and it came down to what the heck are these people eating? So the number one thing in dentistry is what are you eating? And so when you open somebody's mouth and look, oh, I have root canals, I have fillings, I have crowns. Whatever you were eating that was related to that, and whatever was related to all your organ systems that we've talked about numerous times, is going on inside your body at the same time. So the mouth is the window to the world. So looking in somebody's mouth, looking at their restorations, gives you a clue as to what has been happening over all the years that they had the fillings. Say, well, I got these fillings when I was a kid. Well, ever since then, your insides have been suffering the effects of that on an ongoing basis. So just a couple of things. First of all, like root canals, we'll talk about, implants, we'll talk about, but there's going to be invariably after this podcast, people say, "Well, you didn't talk about X, Y, Z." I can't talk about everything because, like everything I've done throughout this, I do a whole day lecture on dentistry to not to people who aren't dentists to basically try and cover some of the the really the basics of trying to understand. People say, is an electric toothbrush better than manual brushing? Should you use water? Should you use a water pick? Should you use water floss? Is manual floss? I mean, there's a million one questions, and so that's all that stuff is individual. My response is, well, what feels better to you? Personally, my wife loves to use electric toothbrushes. I hate electric toothbrushes. I've never used one.
I
She
was
she
gonna say
likes to
that.
use she likes to use, a water pick, a water floss. It's like, really? It's like, what the hell is this? I didn't learn that when I learned dentistry. It's like this was all you used your own hands. And unless you have some type of, MS or some coordination issue, I still believe that using manually is a great way to brush your teeth if you're doing it properly.
Hang on, can I just add,
Yeah.
when I was a kid, my dad would like walk around with a toothbrush in his mouth like all the time, and he'd come in and like he'd make his lunch when he was going to school or whatever, and he'd have a toothbrush in his mouth. He's just used to
Yeah,
it.
typically.
Yeah.
Yeah, well, that's kind of the way it was because they said, what have you got in your mouth? It's just your saliva. So what's wrong with swallowing? You don't need to be standing at the sink and spitting all the time. There's nothing wrong with it. In fact, you
Right.
don't need toothpaste. You just need to have the brush go where it needs to be, which is basically to clean the surface of the teeth. And, while an electric toothbrush is generally 2 minutes, I said, well, it's hard to do a good job in 2 minutes in general, electric toothbrush or otherwise because people are usually scrubbing their teeth. We're not scrubbing the floor. We're just basically wiping the plaque that has formed in the last 24 hours, ideally disorganizing it. You're never going to get rid of it because within 15 minutes after I'll call it a sanitizing cleaning at the hygienist, the plaque is starting to form again. The key thing about oral hygiene is that you have to disrupt the plaque minimally every 24 hours. And the reason is because it takes about 24 hours for the plaque, and the plaque is basically a bacteria. Your oral cavity, like your whole gastrointestinal tract, has its own microbiome, and that microbiome is full of different bacteria. The most common one that causes dental cavities is called Streptococcus mutans. If you keep the Streptococcus mutans at a low level, when you eat some type of food, I'm going to say refined carbohydrate, the body and then that's what the Streptococcus mutans eats. When the Streptococcus mutans eats, it pees and it poops, and when it pees and it poops, it creates acid. And when the acid, the pH in your mouth drops below 5.5, then basically it's enough to demineralize the surface of the tooth. You do that day in, day out, day in, day out, day in, day out. Oh my gosh, you're starting to break down the enamel of the tooth. Oh my God, the enamel's gone. The enamel cannot repair itself, although stem cells in the future probably will be able to, and maybe one day will actually. In fact, in Australia, they're already doing this research for what's going on in general. So the goal of oral hygiene, and people say, when should I brush my teeth? People typically, you brush your teeth after you eat. No, you should brush your teeth before you eat. If you have zero plaque on your teeth, if you have zero, you could friggin' eat a candy store and it's like, oh, I'm not going to get a cavity per se because there's nothing there to ferment all this sugar. I'm not suggesting you eat that, by the way, but there's nothing there to ferment the sugar that's in candy. And sugar is a word that is misleading because really what you're talking about is fermentable carbohydrates. So a piece of bread is just as theoretic carcinogenic, causing cavities, as eating a chocolate candy or a mint or anything like that has sugar associated with it. So the first thing is every 24 hours you basically need to disrupt this plaque. So ideally first thing in the morning, last thing at night are perfect times to do it. Rinsing your mouth with water doesn't remove plaque, but it feels good and actually massages your gums. So there's obviously nothing wrong with doing that type of a behavior. If we look at what's necessary for a cavity, we need a tooth, we need the aspect of the microbiome, and we need a fermentable carbohydrate. Those are the three things that are necessary. Did anybody hear me say fluoride? Oh, you didn't say fluoride. No, fluoride has nothing to do with cavities or not. Fluoride is not the essential component of preventing cavities, disrupting the plaque, and not over consuming fermentable carbohydrates will prevent. That's, remember I said for Weston Price, no dentist, no cavities, no toothbrushes. They never brushed their teeth and they never had a cavity. But they also didn't eat fermentable carbohydrates per se. So you take one, if you don't want to have a cavity, you can take the tooth out. You're not going to get a cavity in that tooth. It's not even there. You take away or minimize fermentable carbohydrates, you're not going to get a cavity. You basically look at the aspect of just disrupting the plaque every 24 hours, you're not going to get a cavity. Fluoride has been put in, and there's whole controversies as it causes cancer, and it's like yada yada. Well, I'll tell you the one thing about fluoride that I learned when I was in dental school. When I was in dental school, the treatment for osteoporosis was fluoride. That's what we used to do. We were taught give fluoride to women and men who had osteoporosis. And then they did that for a few years and they went, oops, not a good idea. Because fluoride actually made the teeth or the bones so brittle that if you fell and broke your hip, you didn't put it back together because now it was like a lifesaver. It shattered. And they said, yeah, it makes it hard, but it makes it so brittle. Okay, you no longer hear fluoride being used as one of the treatments, but that's what I was taught in dental school. So yeah, we've changed things. Now we have other stuff that causes different types of problems. And I just read yesterday, literally, that now they're looking at some of the osteoporosis drugs actually causing low calcium in the blood. Duh. What did you expect it to do for what's going on? So, anything that you take, there's that something else that you need to look at the picture of what's going on. So enough said about fluoride, enough said about, just the aspect of oral hygiene.
What
The
about
most
tongue brushing? Because that's huge, right? Or brushing, yeah, like the tongue scraping. Is that important
Yeah,
to get the bacteria off?
tongue, yeah, absolutely. It's just another way of, of lowering or altering the flora that's in your mouth. It's always going to be there, by the way. You don't get rid of it. All you're doing is disrupting it. All you need to disrupt it, and if it can't form new colonies, you need a whole colony of these bacteria, these flora, to create enough acid that ultimately will demineralize the tooth. Now, not only do the same bacteria cause dental decay, they also cause periodontal disease. So, the rule of thumb is under 35, these bacteria are more susceptible to caries. Over 35, they're more susceptible to periodontal disease. But they're both causing both things at the same time,
So what about
in
people?
general.
Okay. So what about people who tend to breathe more through their mouth? Are they more susceptible to this because they're letting in more bacteria versus people who breathe through their nose?
It's not so much letting in more bacteria, it's about you're drying out the mucous membranes. And one of the most important anti-cariogenic therapies you have is saliva. And people who don't have saliva, like people with Sjogren's syndrome, for example, or people who had radiation, or people who've had take a variety of medications that literally dry up their mouth. And then saliva is one of the best buffering agents we have. And why is part of our basic treatment guidelines, don't drink when you eat? Is because what you're doing is you're minimizing saliva from being produced. It's not only to help digesting of the food, but saliva is also necessary to keep coating your oral cavity, your periodontal ligaments, your periodontal tissue, and your teeth with moisture. That is a buffering agent that's essential. So mouth breathing and dry mouths, people, I wake up, I have to take a sip of water. Okay, if you're mouth breathing all the time, you're going to have a higher susceptibility potentially because you're drying out your saliva for all intents and purposes. So that's the issue with that more than through the nose or the bacteria. You're breathing in stuff. There's for every cubic centimeter, there's probably 10 million bacteria and viruses. So whether you air breathe, mouth breathe, that's not the difference. It's the saliva that becomes the most important rule of thumb in that regard, per se.
Is it true that your mouth is like your first line of defense for your immune system then?
Absolutely. And the first line of defense is called saliva.
There you go.
That's
Okay.
that's it. Yeah, that's why we have salivary glands. Salivary glands are not there just so we can spit. They're there. They have a very important purpose. of moist, keeping our tissues, our tongue, our periodontal tissue, all areas of our mouth moisturized. First of all, it feels more comfortable than when it's too dry, and that's to basically keep all the bacteria that are always there. And once again, you can't sterilize your mouth. You can't, people, you saw that commercial for Listerine. I don't know if they still do it, but it used to be in my day. Listerine, it kills 99% of 9 germs. Yeah, it does for
Yeah.
1 minute, and 1 minute later they're coming back. So it's like they don't go away. It's not that easy. It's not that easily done. So that's not a recommendation to try and improve the oral flora. The oral flora is done through everything else we've ever suggested on every podcast called Basic Treatment Guidelines: healthy food, healthy diet, probiotics, et cetera, et cetera.
So is your
So
saliva linked to your lymphatic system?
your saliva it's not technically, it is that we can say it has a component of a detoxing. I don't think of it as part of the lymphatic system because it's not ultimately, I mean, you're swallowing it, it gets into your digestive system to help digestion. Does it, of course, all liquid eventually will end up back in the lymphatic. So in a very indirect way,
Okay.
yes, but certainly the main line for saliva is what's happening in your mouth, particularly for helping to digest food, and to keep the tissues moist, and to keep the bacteria that are always there in check. That's the main function of saliva.
So then just to go back to the mouthwash, there's been some like I'll say controversy, but they're saying that, people should avoid mouthwash now because you're ruining bacteria and, it's a lot of the stuff that's in bacteria or sorry, in mouthwash, they have cancer causing agents. Say same thing with like some of the toothpaste, like the I don't know. When you look, I don't know, I don't buy like the typical toothpaste, but when you look at the color, like there's red dye or blue dye, whatever, that sort of thing, that's probably not the best thing to put in your mouth. But do you have anything to say about like the mouthwash kind of controversy that's happening right now?
It's just as you said, using it, you know, I think of it more of a gargle. If you want to do something to help that, you're best to gargle water and some probiotics. And then folic acid is another thing that's very helpful for that. Oil pulling is
Oh
another
yeah.
thing that has been used in Ayurvedic medicine for a zillion years. They historically have used sesame oil as oil pulling, and what I say is like giving a massage to your oral tissue, per se. I'm not a fan of using oil pulling on an everyday basis, but I think like anything, it could be a component of your oral hygiene practice. And so whether you do it once a week or a couple times a week, it's like massaging. I think you can massage your periodontal tissue with your toothbrush, with your dental floss, and your whether you're using a water pick or water floss, whatever you're using, what you're doing, all the things that have one goal: disorganize the plaque every 24 hours so that there's not enough colonies of this plaque to create enough acid when they digest a fermentable carbohydrate and ultimately cause acid. The acid breaks down the enamel, gets deeper and deeper. The enamel doesn't repair, gets into the dentin. The dentin then starts to irritate the pulp. And then we get inflammation. Then we end up with supposedly a need for a root canal, which we'll talk about in a minute. But
Okay.
before we get there, okay.
Sorry, it's like I'm kind of taking
So
it. I have all these questions and I'm like
I
they just
know
keep coming up.
there's going to
Well,
be a million and one before we are done this thing. Yeah,
well, because
I
as
know.
you're talking, and I'm like, yeah, like my dentist always tells me is like stop pushing so hard when you use the manual because it recedes the gums. So I know
Hmm.
like you talked about pressure and that sort of thing. Like that's important that you don't need like a jackhammer in there. Like you're just trying to disrupt. It's like the same thing with the lymphatic system when you're doing lymphatic, dry brushing or just using a gua sha tool. You only need the weight of like if you put a nickel on the back of your hand, that's the amount of weight you need. That's it. Like you don't have to like
Right.
whatever. And I think that's what's coming up. And then also like I was taught in term like from the personal training perspective and the muscle perspective, your tongue is like your rudder in terms of movement. And so many people when you push, if you push your tongue on the outside of your, on the inside of your cheek and push it to the left, push it to the right, or even just do circles, try to do 5 one way. Keep your lips closed. Everybody just try it. Put your lips all the way around, 5 circles one way, 5 circles the other way. And you notice how fatiguing that is. That just goes to show like we have a lot of tension in our jaw. So like my dad's saying is that, if you use a manual brush, you're gonna loosen up that fascia and that your rudder, your movement rudder. Like if you have back pain, if you have knee pain, hip pain, it's linked to and neck pain, it's linked to your tongue, in my world. So just from a myofascial perspective, brushing your teeth manually can help you with that. So just I want to throw that in there. But yeah, so we want to dive into, those people that have metal in their mouth, that they have the cavities, they've had root canals. What can we say to them in order to help them with their oral hygiene and their health?
Well, the oral hygiene thing is regardless of what you have going on, whether you have implants, root canals, crowns, bridges, partial dentures, et cetera. Even if you have a complete set of dentures, you should still be doing oral hygiene practices, because what you need to do is you need to keep stimulating that mucosa in a full denture situation that's underneath the full dentures. But as far as a cause, let's look at the metal that you just mentioned. And the most common metal in my day, as I said, 50 years ago, was mercury amalgam. And the issue with amalgam, and what does amalgam? Amalgam simply means the combination of different metals. There's 4 main metals. So and then mercury, which is a liquid per se, is used as the glue to hold the metals together per se. So, when the dentist puts in a mercury filling per se, it's a malleable, soft material, that's a little more consistent than paste, but they prepare the tooth properly to be able to, to support the filling. That they've removed the cavity, they removed all the decay from the tooth. They've now prepared it. They put a liner in there, whatever they have to do, and now we put a band on and we pack in the metal in there. So the mercury at that particular point in the tooth, in the filling, is somewhere between 48-50%. About half of the filling material is mercury. So the whole thing with mercury, as everybody knows, is one of the most poisonous substances that we can be exposed to. There is 100%, and everybody talk, if you're pregnant, don't eat sharks and don't eat certain types of fish, because the big fish will tend to accumulate, they bioaccumulate, and they eat smaller fish that basically, because mercury is being dumped into the ocean, into the water, the fish eat it, smaller fish eat it, the bigger fish eat that, the bigger fish eat that, the bigger fish eat that. So tuna, 1,000-pound fish, sharks, 100 pounds fish. I'm sure whales would also have tons of mercury if people were to eat whales, generally speaking, which would be enough food for a year per se. But they get a hell of a lot of mercury from doing that because they're eating all this smaller fish. But they also eat plankton. Some whales don't eat plankton; they don't eat other fish. So anyway, this mercury filling, what the issue is, okay, so you got this mercury filling in here. So the issue with an amalgam is that it doesn't breathe. So when it's hot or cold, it expands and contracts, expands and contracts, expands and contracts. I'm sure there's people listening to this podcast that will have had a mercury filling in their tooth, and then at some point, 5 years later, at some point, they go to the dentist. They say, "Oh, half the tooth fell off." So literally, the filling is still there, but all the supporting material of the structure that was holding the filling in has fallen off. And now the dentist says, "Well, we got no tooth material left to put a new filling in, so we're going to have to do a crown, which is basically a cap that goes over top because there's nothing to support the filling." So that's one of the challenges with mercury fillings, because with hot and cold, you drink something hot, you drink something cold, you eat cold food, hot food, expand, contract, expand, contract. So the other issue is with mercury fillings is that when you chew, every time you chew, your teeth, and every time you swallow, for that matter, not just eating foods, but every time you swallow, because you're swallowing your saliva all day long, it's constantly being secreted, but you're not spitting it out. At least I hope you're not all day long. And so the abrasion of the tooth against the filling is literally abrading, the filling material. So the concept is that over a period of time, every time you abrade it, you release mercury molecules. And these mercury molecules only have opposite. You either breathe them out or you have to breathe them in. And if you breathe them in, it gets into the respiratory mucosa, and your immune system says, "Oh, what the hell is that? This isn't supposed to be here. Let's move it somewhere. Let's move it." And it'll either try and move it to the kidney, it'll try and move it to the large intestine, or it'll try and get it to breathe it out again. But if that's not successful over a period of day in, month out, year in, year out, this mercury has the potential of accumulating in the body in different areas, whether it's in your brain or your heart or your intestine or wherever it goes, fat tissue, the bone marrow, it goes wherever it goes. So when you go to a biological dentist, they open your mouth, they see these. I mean, you can open your own mouth, you look at does it look silver? Oh, that's a mercury filling. So when I was doing dentistry and this whole thing was coming up, I spoke with at the time, once again, we're talking 45 years ago, 40 years ago. People had different opinions. And so I said, when the mercury filling is first put in, it's about half mercury and half these metals. Now, at a certain point, you say, why does the filling break? Because people go in, oh, I had a filling there and it broke and I need to replace it. When there's not enough glue, mercury, to hold the material together, the filling breaks. So it can break because of how you bite down, you bit something too hard. I mean, there's other reasons, but generally speaking, the feeling is when the filling material gets down to, I'm going to say half, 25%, there's not enough glue to hold it together, and you just happen to bite something and it breaks, per se. Now you have half a filling. So at that point, you can assume, oh, all the material, all the mercury is pretty much already dissipated. You went from 48% to 25%. Where to go? You either breathed it out, went in your lung, your intestine, kidney, went somewhere. It's not in your tooth anymore. So what I did at the time, and this is just experience. Can't tell you about individuals. So when somebody would come in and say, should I have my mercury fillings removed? And I say, well, how long have you had them? Well, I'm 42 years old and I haven't had any fillings since I was 20. Okay, so they've been there for 20 years. Well, what I can tell you is the mercury has already escaped. You have already done, because the feeling was, in my circle of dentists and colleagues that I worked with at the time, said 15, 17 years, so more or less, is if the filling is going to last, and the filling may last 40 years, and it could. But generally speaking, if the filling is, say, over 20 years of age, I do not recommend the first thing you do is to remove the filling. The main reason is because the greatest exposure you're ever going to get is that removal of the filling. And if you have a dentist who hasn't learned how to do, what we call the smart way of mercury removal, which stands for safe mercury amalgam removal technique, which is a training that's not done in Dell school. At least I don't. Maybe it is now, but it wasn't in my day because we weren't worried about it in those days. Basically now, and so that's using a rubber dam, that's using high volume suction, that's using a lot of water, etc. And if you think about, where the hell does that mercury go when a dentist moves it? Oh, the water supply is connected to the public sanitation system. Guess what? It goes into the water filtration system. What type of system do they have? Supposedly, the dental office is supposed to have a filtration system, basically that filters out and it doesn't allow the mercury. But that may or may not be the case. Hopefully, in newer offices, that's all been taken care of. So I know you got an inquiry just today, Julie, from an individual. I mean, the removal of mercury fillings, and to replace them with either a plastic, porcelain, composite, some type of a white filling, we'll say, or a crown or whatever, is a very expensive proposition. It's not something that many people can easily afford. So my first recommendation is, at some point, if it's 15, 18, 20 years old, I'll say just leave it there. In the meantime, what we're going to try and do is support your bodies with all the VTGs and anything else we need to do, your body, to get rid of any excess mercury that's already in your system. And you have it in your system. we did a biopsy of your liver, I guarantee you we'd find some liver. If we did a biopsy of your brain, I guarantee we'd find some mercury in there in general. However, we don't want to overload the system when we already have a bunch in our system. So we can start this whole support system of detox, depuration, and drainage to try and get the body in a better place. So if and when, and the filling will break at some point, even though, it would be nice to think that it lasts your whole life. It doesn't. It's like anything, it wears. So you don't drive a car forever. A minute sooner or later, you need to repair the thing. So then you find a dentist, a biological dentist usually, who basically will use the smart technique for removal of that with the rubber dam, water, high volume suction, et cetera, et cetera. So, which is a safe way, so you don't get exposed to all this ton of mercury when the filling is being removed. So what do we do in the meantime? I think the question from the query that you had was, what do I do? You work on all your other systems to try and minimize that. And when the time comes and you need the filling replaced, you obviously never replace it with another mercury filling. Now we're going to replace it with a white filling, a porcelain filling, a composite filling, a resin, or whatever the dentist is using at the time. So unless you have a question, that's all I'm going to say about fillings. There's a lot more detail, but that's enough.
No, it's good. I mean, the basic, like my client like mentioned that it's come on her radar, right? So she's like, what are my options at this point? But I think you've explained that is that you can go to a biological dentist, but it is expensive. So it's like, okay, what can I do, to support myself, right? And basic treatment guidelines, start there,
There you go.
right?
There you go.
Basic treatment
Yeah.
guidelines, but yeah. So then in terms of the root canal, is it
Actually, one thing
similar?
before we go to root canal, just
Okay.
I just want to make one comment about toothpaste that I should have
Oh
made.
yeah, yeah. Mm-hmm.
I would like people to go in the store and look at toothpaste, and I'm not going to single out a tooth. Just pick a couple of boxes, read the label, and you know what it says on the label? It says, warning, keep out of the reach of children under 6. More than used for brushing is accidentally swallowed. Call poison control. That's what's on the box of your toothpaste.
Nice.
And yet you're sticking it in your mouth all the time. If a child was to eat about a half of the size of a regular, eat all that toothpaste, that is poison enough to kill the kid. And yet people are
Eek.
sticking it in their mouth all the time.
Eek.
It's like, yeah, they're not eating, we're using a pea-sized amount. So theoretically, we got some things functioning well. We're not worried about that amount of exposure. But once again, you could use baking soda. You could use just water. We're not scrubbing the floor here. As you said, it's like lymphatics. It's very light. You're just disorganizing. And if you have calculus, you're not going to get it off with a toothbrush. You have to go to the hygienist or the dentist. They'll clean it off with their cavitrons and ultrasonic scalers and hand scaling. Once it's calcified, you're not going to get it off with a toothbrush. When it's soft, malleable, disrupted every 24 hours, not a problem. So now we can
So
go back to root canals.
okay. Actually, I have a question though. That like so what about those people that they get stains on their teeth more than like my husband? He gets more stains than I do on on his teeth, and he wants to do the teeth whitening and all that kind of stuff. What do you have to say about that? Like, so that's something that like I remember you telling me as a kid. I don't know. For whatever reason it stuck in my head that like you got your Pepsis and your sodas stain your teeth a lot, and coffee and your basic stuff, smoking, all that kind of stuff stain your teeth. I never did all that, but I mean, I I remember specifically choosing not to drink Coke or Pepsi when I was a kid because it would stain my teeth. So I'd go to 7 Up. So I'm like, I don't know. I'm like, still the sugar at the end of the day. Still comes down to sugar. I mean, I don't drink that stuff anymore, but I mean, this is a long, long time ago. But what about those people that get stains on their teeth? What's that all about? Can you just share a little bit of that?
There are, and in fact, you don't remember, or maybe you don't remember this, but if you remember when you were in the water all the time of swimming, because you were part of the swim team, the chlorine that was in the pools that you swallow has an impact of your microflora, and you were much more susceptible to staining than your brother was because your brother wasn't going in the pool all the time.
I don't
And
remember
so
that.
we had to clean your teeth much more often than Eric's because Eric's teeth didn't stain, but yours did. And it's
Right.
like I could do a cleaning on your teeth, and a month later said, Frig, look at all the stain here because you've been in the pool for the last 30 days and your own microflora, your own saliva, and the chlorine had an individual biochemical reaction that literally formed more stain because it wasn't because you were, drinking coffee and smoking and doing all those types of things.
No.
So the flora in your mouth will have an impact, and some people will be more susceptible. Whitening teeth, I'm anti-whitening because basically what you're doing is you're bleaching. So
Right.
you want to swallow some bleach, do some whitening. That's really what it's trying to bleach the dental tubules and the enamel and that type of. Yeah, it makes it look whiter, but big deal. Teeth are not supposed to be white, by the way. The natural color of teeth, believe it or not, is yellow. Wow.
The movie
Because
theater, the movie industry is going to be like, "Are you kidding?" No.
so if you think about it, if you're wearing a diamond ring, and most married women are,
Yeah.
generally speaking, what do you want? Do you want a diamond that's perfect in clarity, or do you want one that has a flaw and it's like it doesn't have that nice glisten? Enamel, the hardest enamel is like a diamond, and you actually
Mm.
can see through it. And what you're looking at is the underlying structure of the tooth, which is the dentin. And dentin has a yellow color. So when a tooth looks yellow, you're actually looking at a very strong tooth of enamel. Somebody who has really, really white teeth, generally what it means is that the enamel has been clouded like a diamond that ultimately has been clouded. It's been flawed, may be more susceptible to caries, but there are certain conditions that's true. But generally speaking, it still comes down to oral hygiene, saliva, what it is you eat. I mean, it becomes the bottom line as far as your oral hygiene stuff is concerned.
Okay,
So
so I need to stop harassing my children then. Because I'm like, why are your teeth so yellow? Because some are, so it's funny. I have three kids and all their teeth are different. And, but you've explained it. So now I'm like, okay, I don't feel so bad. So it's just everybody,
yellow is
everybody
not.
to each his own.
There's a difference between stain and the actual natural color of the tooth. And in dentistry, if you've had a crown or whatever, especially if it's on our front tooth, the dentist or the hygienist will hold up what we call a shade guide and will
Right.
look for the match of the color of your tooth to be as close to the color. So, and you see they have 50 different colors. So it means, oh my God, people have the teeth colors are 50 different colors. Yeah, we had many, many different colors of teeth
Wow.
because teeth are not all the same color, is the reality. Otherwise, if it was white, it would be one color. Everybody would get the same color, which
Right.
is so white teeth is unnatural. That's not a
Huh.
natural color of your teeth.
You
Even
heard it
though very
here.
people want white teeth. It's
Yeah.
like, no, you want strong teeth with clear enamel, like a clear diamond. If you would be satisfied with a faulty diamond, then you'd probably be satisfied with whiter teeth. If you want a clear diamond, then you're going to be satisfied with a yellow tooth, yellowish looking tooth. And it doesn't mean yellow, yellow like the sun. It means there's a yellow tinge to it. They
Tinge.
still look white, obviously. We're not talking about, oh, somebody's going to suddenly get crowns and they're going to put yellow crowns on all the time because in society. Oh my God, what's wrong with you? Although I just heard that one of the rappers just put stainless steel or something on his front teeth. It's like, oh my
Yeah.
God, whatever.
Yeah.
Yeah, we did that. We did that with kids when I started before this bonding thing that I talked about. That's how we used to
Bless you.
fix kids who broke off their front teeth. We didn't have anything to repair it, so we used to put the stainless steel crown on the thing. It looked awful, but we didn't have any better. So at the
It
time,
works.
so dentistry's improved a lot, obviously in general.
All right. No, I was just gonna say, out of all the different, doctor, you know, industry or whatever, dentistry's really gone after the prevention piece. Like they're really good at getting
Totally.
people to show up for appointments every 6 to 9 months, and just the whole structure is set up that, you go because they know that your mouth is such a important piece to your overall health. Like they know this. So we really need to, I mean, They'll tell you about gum disease and gingivitis and all that kind of stuff. Like we really haven't gotten into that, but I know you're going to talk about root canals and stuff, so I'll let you dive into that, and maybe it'll touch upon how your
Yeah.
root canal can
Yeah.
affect your heart and stuff.
Right. So, so the issue, what is a root canal? So, first of all, the tooth, like any other tissue, needs oxygen, it needs nutrition, and it needs lymphatics. And so, unfortunately, the tooth is the only tissue in the body that has only one source of blood supply, and that's through the tip of the tooth. Every other organ, every other tissue has multiple capillaries that come into it. So if one gets blocked, so for a heart, let's use your heart. So, I mean, we have several coronary arteries. If one gets blocked, you could still survive potentially. If multiple are blocked, you probably will have a heart attack because you're not getting enough oxygen for receiving. But generally speaking, all tissues in the body except one, the tooth, has only one blood supply. So if something disrupts the blood supply, the first thing we'll say is trauma. So, a child falls down, or you fall down, or you get hit in the mouth, whether you're a hockey player, soccer player, whatever, somehow, and you hit the tooth. In children, the bone isn't rock hard. So teeth in children can actually bend a little bit without literally shearing off the blood supply. In an adult, it's not so giving, and the bone is harder. And so if you have trauma and the tooth moves, you'll often shear off the blood supply. So that's we'll say the first reason, for all intents and purposes, we'll call it the tooth loses its vitality. It loses its vitality because it loses its blood supply, which means you can't get oxygen in, you can't get waste products out, the lymphatic system doesn't work in there. When that happens, the material inside the pulp chamber, inside the tooth, becomes necrotic. When it becomes necrotic, it starts to create gas. When it starts to create gas, it says, well, how do I get out? I can't get out. So it has to come out the tip of the tooth. That's when somebody says, oh my God, I have a toothache. Oh, this tooth is killing me. What's happening? Why? Because the gas pressure inside the tooth is building up and trying to extend into the lower jaw or into the sinus, depending if it's an upper or lower tooth that's going on. You go to the dentist looks at the tooth and say, I don't see anything wrong with that tooth. I mean, there's no filling on the tooth, there's no cavity on the tooth. Why is that tooth sore? They'll take an x-ray and they'll say, oh, maybe it's your sinus. And sometimes people with sinusitis, for example, will have toothaches because the pressure of the mucus in the sinus will push down on the lining of the floor of the sinus, and the tooth is right against it. That may compress the blood supply into the tooth temporarily. And so the tooth will be sore, even though it's not really a toothache. It's a sinus problem. You have to correct the sinus problem, and then the tooth problem goes away. So that's the one of the realities that happens. Trauma is something that ultimately, and so with a trauma toothpaste, with a trauma to the tooth in general, the tooth may die. That is the small percentage of people who need root canals. By far, the 99% of people who need a root canal have had a filling or have a large cavity on the tooth. The filling is either so extensive that it encroaches and is very, very close to the pulp chamber. And so there's not enough space between the protection of the dent material and the vital structures within the tooth. And then eating on this tooth for a period of time creates some degree of trauma. It irritates the tooth. Same process. The pulp chamber, the material in the pulp chamber dies, becomes necrotic, creates gas, can't get out, creates a toothache. So you go to a dentist, the dentist said, we don't call it a dead tooth because it's not really dead. We call it non-vital. Non-vital meaning you're not getting nutrients in and you're not getting waste products out. The reason I don't call it a dead tooth is because if you tap on and anybody has it, if you just do it right now, if you tap on a root canal tooth, I'll say, do you feel it? I say, I feel something. I said, yeah, what you feel is the movement in your lateral ligament. If you extend your arm and bend your arm, did you feel it? Yeah, you felt that your arm moved because your ligaments are still there. When you have a root canal tooth, it's in the jawbone and it's held in the jawbone by the periodontal ligament. So when you tap on a tooth and say, I feel it, what you're feeling is the movement of the periodontal ligament. So that's why it's not a dead tooth, it's a non-vital tooth. What you will not feel in a root canal tooth is hot or cold. And the reason you won't feel hot or cold because the vital structures that determine that are gone. Because if you've had a root canal, that material has been removed, replaced with an inert material. Most of the time, it's called gutta percha. That basically has been used, to replace that per se. So now we have the discussion. Okay, so actually, do you have any questions about the root canal at this point? No. Okay.
No.
Okay. So now you've had a root canal and a tooth, and then you go to somebody, whether it's a functional medicine doctor or somebody who's doing some type of testing, a naturopath, maybe a biological doctor, or biological dentist. And they said, "Oh my God, I take all these X-rays. You have 4 root canals. We got to take those root canals out." But doctor, they don't bother me. Oh yeah, but they're a source of a chronic infection. So we got to take them out. You have basically a chronic infection in your mouth that is constantly feeding an infection in your body. Okay. And how did you come to that opinion? Well, we've done these studies that when we have removed root canal teeth, and looked under the microscope and done a DNA study, we find that there's all kinds of different bacteria in the tooth. These bacteria are therefore causing you to have a chronic infection. Oh, really? What makes you think that? Have you examined the rest of my body in any other way? No, I just know that these teeth cause infection. Okay, that's interesting thought. Okay, so if you had the same bacteria in your shin, would you immediately say, "Oh, let's cut your shin off"? Now you have a chronic infection in your shin. You said you should do it to my tooth. Now you want to, but you don't want to do it in my shin. Why don't you want to do it in my shin? Oh, well, we'll give you an antibiotic. Well, why don't you give an antibiotic for the tooth? Well, because we can't heal the tooth. You're right, but what you can heal is the tissue around the tooth. The periodontal ligament, which you feel when you tap your tooth, is vital. It's attached to the bone. It has a very vital blood supply for what's going on. So the theory from the biological dentist or functional medicine or anybody else who sort of wants you to believe that all root canal teeth are bad and all root canal teeth need to be removed are the theory that the root canal tooth is a source of chronic infection because in the tubules, and there's a few miles of tubules, believe it or not, in every tooth per se, in those tubules are anaerobic bacteria. Anaerobic bacteria means they don't need oxygen in order to survive and they can continue. And these anaerobic bacteria escape from the tooth and get into the periodontal ligament. And if they get into the periodontal ligament, theoretically, if you think about it, what should happen? Oh, this is live tissue. The periodontal ligament should say, we have blood supply. If I have blood supply, I have oxygen coming in, I have an immune system. My immune system, why can't my immune system take care of this? So if you have a depleted immune system, which actually is going to be the topic of our next podcast for what's going on, it is likely that your body cannot get ahead of it. So there are some people in those cases with other things that are going on that maybe the removal of the root canal tooth may be in the patient's best interest. But generally speaking, what's in my personal experience of doing literally thousands and thousands of root canal teeth for people over the years, if it's done properly, that's a whole other discussion we'll get to in a minute. If and not the way that's done now, but the way I was trained to do them, I believed when I was doing dentistry, that was probably the most successful procedure I ever did. As far as I had many more fillings fail, I had many more crowns fail, I had many more other things fail than root canals because of the way I was taught to do them. And that's not how they're doing now. And I think that's one of the issues nowadays. So every root canal tooth does not need to be removed, in my opinion. I think that needs to be individually assessed based on the person's overall health aspects that are going on. because if you remove the tooth, now what are you gonna do? Now we're gonna put a foreign material back in. Now you're putting a foreign object. Titanium is common, but now we're suggesting that ceramics would actually are more inert and potentially are a better form of an implant, because some people will react to titanium, and that causes its own set of problems, and then they have to have the implant taken out too. Plus, there's another thousands of dollars of cost to do that, as opposed to whatever $1,500, $2,000 to do a root canal. And if it's done properly and efficiently, I believe it could last literally forever. I think it can last longer than a filling can, if the other things are being taken care of in general. So it's not a matter of they're all bad, everybody needs to have them removed because they're causing everybody's health problems. That is not my personal experience as both a dentist and a biological doctor in general. So what does need to happen, if you do have necrosis inside a tooth, you absolutely have only two things to do. You either have to take the tooth out, or you have to do a root canal, a successful root canal. That tooth will not heal by itself. People, in my field say, well, what if I have homeopathic remedies? I have herbal remedies. I can do ozone. I can do all this stuff. I said, well, I don't care what you do. If you have necrotic material inside the pulp chamber, you have no blood supply. How the hell are you going to get anything in there? It's great that you can use ozone, but there's nothing going in there. How are you going to get it in? It just doesn't diffuse in, per se. So in those cases, you have to open the tooth, clean it out, which is what a root canal is. So a root canal is you drill a hole in the top of the tooth, and you basically go in with, we call them files and reamers, and we literally clean out, just like you're sanding, the board, rough board. We're sanding the inside. At the same time, we're flushing it out with bicarbonate, sodium chloride and bicarbonate and stuff, to try and create some level of sterility. Now we have laser treatments. We have lasers that once the tooth is open, you can use a laser in there. You can actually put ozone directly into the tooth before it's filled, per se, to try and help minimize the bacteria. And there's zillions of bacteria in there, zillions, per se. And then we basically totally clean it out. We flush it out. We ozone it. We laser it. And then ideally, what you then do is you put a temporary filling on there and you don't do anything. You leave it alone. In my day, a root canal was never done in less than 3 appointments. 3 appointments. Now, virtually all people are having 1 appointment root canals. Oh, and at the end of the root canal, here, take the antibiotic and take this painkiller, just in case. I can guarantee you, if you've done a root canal that way, even though the endodontist will say, I use the microscope, I use laser, it's like, I don't care what you use. Let the body do its job. The body needs to be part of this healing process, not just the mechanical treatment that the endodontist is doing when he's doing the root canal. So every time a patient asks me about a root canal, I said, go to your endodontist and see if they'll amuse you and do the root canal over 3 visits as opposed to 1 visit. What I would used to do, I would open it. And of course, what is opening it do? It allows the gas to escape, so the pain goes away. We flush it out. We close it for a couple of weeks. We come back. We come back. We file. We ream. We sterilize. We flush it out. Put a temporary filling in. You come back in a couple of weeks. Ask the patient, how did that feel? They say, feels like every other tooth. Feels wonderful. Great. Now I know I can go back in. I can flush it out. Maybe do a little more cleaning. Dry it out. Then I put the inert material in. Got a percha. And all the while I'm doing is I'm taking an X-ray to make sure that I'm exactly at the end of the tip of the tooth, that we actually are cleaning it properly. The ones that are failing that I hear about are usually 1 treatment root canals, usually done by a general dentist more often than an endodontist, because they're not as sophisticated, I'll say, and in general. And then when you take an X-ray, you see that they only manipulated half of the tooth. Like they didn't get to the root, or there's another canal that they didn't see, or they don't have a proper X-ray vision to be able to see where the tip of the root is because it's in the sinus or somewhere. Those have the potential of failing without any doubt. The reason I know that body can heal is because, having done thousands of root canals over the years, the goal should be when an endodontist or your general dentist does the root canal, they do it, whatever they do, and then you come back in 3 months and they take another X-ray and you see, did it heal or did it not heal? And it's like the abscess that you could see on an X-ray before you did the root canal is now gone, which meant the bone filled in, just like you break your arm, 6 weeks. I usually would wait 3 months and retake the X-ray. I know if you have an immune system, and I know if we can get blood supply there and it can stimulate it, and we can do things like the oral rinses we talked about, and we can do CoQ10, and we can do things for your, et cetera, et cetera. We have the ability to heal, which is why I believe all root canals do not have to be removed.
Wow. Okay. You heard it here. And I think, well, I mean,
That
it's
is a
like,
difference of opinion of many biological dentists who say every root canal is bad. And I say no,
mm,
because they're a dentist and they're not looking. I'm looking at it, the entire body. The tooth is no different than, I would say, well, why don't we take out everybody's gallbladder? Because I guarantee you, if you remove the gallbladder and looked under the microscope, you know what you'd find? A whole lot of bacteria.
yeah.
Why don't we take out everybody's tonsils, because they're full of bacteria, because their
Hmm.
lymphatic system? Why don't we take out everybody's appendix? It's full of bacteria. Why don't we we don't, because we know the body has the ability to heal itself, no more than we would cut somebody's shin off because you have an infection there and say, oh, you got all these bacteria, we're just cut the shin off. That's kind of what, to me, that's kind of the illogical explanation that's given. Oh, it's tooth, it's a source of infection, it'll always be there because there's no blood supply. I said the tooth doesn't have the blood supply, but the periodontal ligament and the bone supporting the tooth has a blood supply. That's the difference.
Good to know. I'm like, all I keep thinking about though is that, like, if I'm going to go meet, a dentist that's going to do this, um, safety really has to be established, because I find that I remember one time, like, when I was actually in university, I came home and I went and saw a new dentist or something like that. And I was supposed to get my wisdom teeth pulled. And they said I had a whole bunch of cavities, but they sent me the x-ray. Do you remember this? They gave me the x-rays and I showed them to you. And they're like, that's not really a cavity. So it was like, I don't know, like this whole trust thing came up for me, because this dentist is saying, "Oh, I have all these cavities," but then you're like, "That's not really a cavity." Like that's, it's like they want to do more treatment that's really necessary. So that's all that was coming up for me. It's like, okay, if somebody's going to do a root canal, make sure you ask questions. Don't just take it full, like, don't just take it full value. Yep, okay, because I recognize that people, when you're in pain, you're just like, take away the pain. Who can I get in
Right,
first, and who can I take away the pain? But you need to ask questions, right? And that's kind of the point of this
correct.
podcast, is to educate you and know what kind of questions should you ask. Like, how many appointments is this root canal going to take? And if they say one, say thank you very much, get up, leave, and go to the next one, because that's not the guy you want to work with, or girl, or whoever, right? So these are the type of things that I think is powerful, and safety really has to come into question here. And arm yourself with some questions, and don't just take it for face value, because I think that's what a lot of us do. We're just like, who can get me in, who fits my schedule best? And like, I'm full honesty, my current dentist, like, so my old dentist was somebody that went to school with my dad, but like you said, you've been doing it your 50th anniversary. He retired. So I had to go find a dentist. And full honesty, the dentist we chose was somebody that can fit into our schedule and can fit all of us in at the same time. So I don't have to go back 5 different times. Right. So it's a large office. And now it makes me, I'm like, I need to ask better questions. Makes me realize, like, I have to ask some better questions, especially when it comes to my kids and whatnot, and know what to look for. Right. So that's all I wanted to
Right.
add in. So, anyway, is
Yeah.
there more that you wanted to share on all of that? Like, I know we can make this super long
Um,
again. This is a long one.
I'm just gonna, because in the interest of time, and the goal was about root canals and Mercury, I just want to mention that I think you mentioned the last time, there is a tooth chart, and I would recommend that
Yes.
everybody go online and download. We call it a meridian tooth. Just put in Google meridian tooth chart, And what you'll
Hmm.
do is a picture will come up and it'll show the teeth, and it will show organs that the teeth relate to. And so, what you look at then is, if you have a root canal, look at the organs, look at the tissues, look at the things that are associated with that organ. And so it's a bit of a clue. There was a statement recently that I received. This is sort of the other side of the fence, where this doctor, I guess I don't know if he's a biological doctor, but anyway, he's functional for sure. So he said that, in his opinion, 90% of the breast cancer patients that he saw had a root canal on the second molar, or the first molar, or second premolar. And I said, what about the tens of millions of people who have a root canal who don't have breast cancer? What about men who have root canal? Why don't they all have breast cancer? Because he's basically saying, if you have a root canal in that tooth, you're going to get breast cancer. So
Hmm.
he was, which
Big
is
statement.
absolutely makes no sense. It's a statement that makes no sense when you really think about it. It's like, really? You're putting everything in a box, and that's sort of the
Yeah.
allopathic model that we talked about last one. We talked about cancer. Everybody fits in the same box. It's like nothing, nobody fits in the same box. But anyway, I highly recommend that people go on Google, have that tooth chart for them, just from a personal education perspective. And there's five main meridians that fit to the teeth, and you'll see when you look at the chart. You have the one that's related to the urogenital system, one that's related to the eye teeth. The four eye teeth are the what's related to your liver and gallbladder. Then you have teeth related to your large intestine, your stomach and thyroid, and the heart and small intestine. And since you mentioned heart last time, we'll talk about it. The heart meridian is related to your wisdom teeth. So
Hmm.
the last tooth, top and bottom. Now, many people don't have enough room, and in fact, in my entire dental career, I probably saw 5 people that had enough space for 32 teeth. When Weston Price did his work back in the teens and 20s before he wrote his book, everybody had 32 teeth. They had enough space, wide jaws, wide nose, nasal passages, big jaw, etc. They had plenty of space. We don't have enough space anymore. In fact, the second tooth, the lateral teeth, the ones on each side of our primary central teeth, generally are being phased out. We don't have enough space. So ecologically, it's probably true in another 1,000 years, we may only have 20 teeth, because our jaws are getting smaller and smaller,
Wow.
unfortunately. And these teeth are genetic, missing. People are missing wisdom teeth. People are missing these laterals. People are starting to miss premolars, et cetera, et cetera, over just in even in the last 100 years of, I'll say, westernized medicine and westernized dentistry, and the aspect of a processed food diet as opposed to a whole food diet in general. So the going to the cardiac one, the wisdom teeth, which many people, there's an issue there. And cavitations, we don't have time talking about cavitation. Maybe we'll have to do another thing on dentistry in the future,
I
in
think so. I think
general.
it's gonna be a popular topic subject.
You're probably going to get a ton of questions on this one. What about that? Yada yada yada. So we'll
Yeah.
end up having to talk about that. But anytime somebody has a cardiac issue, no matter what, you should always ask, what happened to your wisdom teeth? So often. So people will have, palpitations, or it's like a flutter. And then you
Heart
ask,
murmur like me?
what heart murmur? What
Yeah.
happened to your wisdom teeth in general?
Well,
Go
me?
ahead.
Are you asking me? But well, my
Yeah, yeah, yeah.
situation. So I got mine pulled, and then I had I got an infection or whatever. So
Dry socket.
thank you. I had a dry socket. So it was a lot. I was like, oh my god, if this is the type of pain I have to live with for the rest of my life, I'm like, just kill me now. This is brutal. So then they went back, fixed it, but they did. They were able to fix it. They gave me medicine. They cleaned out the socket and the whole bit, and then they tested my heart and they found a heart murmur.
So the aspects of there is a correlation between wisdom teeth and heart issues. There also are other problems with the heart. You have physical problems, we call it the plumber problems, and then we have electrical problems, which is like a murmur in general. So there's other things going on, but one of the big, when we look at the big picture, and as biological medicine, we try to look at the big picture. We look at as many variables as feasible and possible. And when we do that, we start to realize, oh, we have to do something about the oral cavity. We have to do something about the teeth. And that chart may be a bit of a clue for you individually, those listening. That may be, a piece of the puzzle that hasn't been considered either by yourself, your dentist, or your physician as to maybe it's a piece of the problem. I always remember when I was first introduced to this, the person came in and said, my eye tooth, which is the third one from the middle, the eye tooth, the fang will say it's the corner of the mouth. They said, "Oh, this tooth is killing me." I said, "There's something wrong with it." And so I looked at, I said, oh, I took an x-ray. I said, don't see anything. It's not in the sinus. You don't have any cavity there. Have you had any trauma? Nope. Didn't know what it was. They said, I don't know what it is, but there's nothing wrong with the tooth. Well, within a couple of weeks, this person had a gallbladder attack. They weren't having pain in their gallbladder. They were having pain in the tooth. And the vice versa happens. You can actually have needed something done to the tooth. You don't feel it in your tooth. The pain was in their gallbladder. They said there's something with my digestion. It's like my digestion feels terrible. They go on ultrasound. I don't see anything wrong. Your gallbladder looks great. I don't know what it is. So nobody then started to correlate the tooth and the organ. And now, of course, we have the tooth chart that correlates all the teeth to all the organs. And it's just another piece of a puzzle if you're looking. I'm not saying that everybody who has a gallbladder problem has a problem with their tooth. I'm just saying it's on a meridian. It's all energetics. Energetics have an interesting way of presenting in the body, and this is another tool that we can utilize to try and understand, the individual makeup of an individual's health problems.
I think it's cool. Like I've used it and I've taught it in my academy and whatnot because again, it's another tool to help you connect the dots and put pieces of the puzzle, right? Because everything in our body, as we've said before, is connected. No system works alone, right? So it
Right.
might just give you more insight to understanding more about your own body because essentially, as my dad said, we don't think in a box, we don't live in a box. So let's explore and see what systems and what are the systems trying to tell us, because your body, like, you might not be listening, so you're gonna listen to the pain in your, like a toothache, you're gonna pay attention. They suck, like we all know, like but it might be,
Yep, it does.
it's not necessarily because you haven't been brushing enough or brushing too hard or whatever. Oh yeah, so what about flossing? That's the biggest thing, right? What are your thoughts on flossing? Gotta floss, get the gunk out of your middle of your teeth.
Well, the toothbrush can't reach between the teeth, and the toothbrush can't reach below, more than 3 millimeters below the gum line. So there's other components of the oral hygiene that we've already talked about that can be a piece of it. The area where the teeth touch together, obviously they're in contact. So, you can go partially on inside and outside, but you can't theoretically get directly between the teeth. And depending on everything else that's going on there, it's a way to try and keep removing, the plaque, disorganizing the plaque that's between your teeth. So it's no different than any other, you have specific perio, you can have, toothpicks and perio stimulators and water picks and water flosses. And so the individual oral hygiene program literally needs to be individualized. And once again, it's not one fits all. Just like Lee's loves the mechanical stuff. I hate the mechanical stuff, so I do everything manually, personally.
To each his own, right? Same thing, like my
To
kids.
each his own.
Yeah,
To each his
my
own.
kids they like the new floss picks, I guess. It's easy for them to
Hmm.
use versus,
Yeah,
like
it's easy to use. It's convenient. Yep.
yeah,
Yep. Mhm.
because they
Yeah.
can use the end, and their teeth they're losing teeth and they're growing teeth and all that kind of stuff. Like Caleb thinks
You
he
know,
thinks he's getting his wisdom teeth already, and I'm like, buddy, you're not old enough. And like, that's a molar. He's like, oh,
be
how many
another
do
10 years.
I know?
He's
But
had
he's
the
like,
he's getting the 12-year molar.
I know, right? He is. But he's like, oh, these my wisdom teeth, mom. This is what I'm feeling. Like, not yet, bud, not yet. I'm like, he wants to be old. He wants to age. I'm like, bud, enjoy being 12. So funny.
So, another thing you may not remember is that we brushed your teeth and your brother's teeth till you were 5,
Yes. I do
5 years of
remember
age.
that. I do remember. And I remember
Yeah.
you brushing my kids' teeth when we were here.
Yeah.
You'd brush them and teach them and like
Yeah.
show them how to do it and all that kind of stuff.
Yeah.
Cause yeah. But that's
Yep.
why like my
Yeah.
kids they right now use they use the manual, not the manual. They use the electric toothbrush
The
because they
electric.
don't do it long enough. They just do it like
Yeah, that's a problem.
whatever. They just do like the two
Yeah.
front teeth, and I'm like, no, that's not what Grandpa showed you. I don't remember. I'm like, okay, well, Grandpa will show you when we see you next. I'll make Grandpa brush your teeth
Yeah.
again.
Okay. There you go. Yeah.
So yeah, if
All
you go
right.
see my dad as a patient, then he'll show him. You can show people how to brush their teeth, Dad. Do a YouTube
Oh yeah.
video.
Yeah, right.
Gentle,
Indeed.
gentle, gentle,
Right.
gentle.
Yeah, I keep saying you're not scrubbing the floor. You're just
No,
trying to remove it's like dust. You're just trying to brush it out of the way. If
and
you
that's the
do
thing
it
too.
regularly.
My our dentist, my husband, they told him he needs the really soft bristles because he brushes too hard, so he has to get the extra.
Hmm.
There's extra soft
Yeah, 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 yeah,
manual.
yeah.
Like my husband's a manual guy too, and so but he has to get the extra soft because he's like he hasn't figured that out yet. But maybe he'll get it one day. I don't know.
Yeah.
It's never too late. You're never too late. Whatever. To
No,
each his
never
own,
too late.
right?
To each his
To
own.
each his.
Right.
All right. All right. Well, that
Okay.
was super informative. That was amazing. Thank you for that. I think we'll have to, like I said, I think we'll have to have another conversation because there's going to be follow-up questions. It's just ironic that literally my inner circle ladies had questions about this, and we are going to record the podcast. So I think the energy has aligned. Energetically, we were meant to talk about this today. So there you go. So
Right.
hopefully
Indeed.
you as the listener enjoyed this and you got a few nuggets out of it. And as my dad mentioned already, our next podcast is going to be how to build a stronger immune system to build off of what we were just talking about. So as always, thank you so much for supporting us and for listening. And I'll do my best to share a link to the chart my dad's talking about in the show notes, so then you can actually see what we're talking about with the meridians and how it connects to the body, so you don't have to go too far to go look for it. But I'll try my best to add that in there. Cool. Thanks so much for being here, and we'll talk to you next time.
Talk to you again. Have a good day.
We want to remind you that knowledge isn't power. Applied knowledge is power, where knowledge turns to experience. We encourage you to implement the information shared, allowing you to shift your health and energy. And if this is your first time listening, we truly appreciate you being here and would love to have your support by subscribing to our channel. We also love hearing from you, so please connect with us and share your thoughts. And if you have any ideas for future podcasts, please let us know. If you're interested in learning more about biological medicine or trauma-informed movement, check out the show notes. Thanks again for listening, and we look forward to connecting with you in the future.